Yes, you have read the title right. In this video, I'm going to share with you what we went through, what we felt when we got tested positive, and what we did to recover from this coronavirus, and what we are doing now to help others, to help the people who were infected with coronavirus. So before you move on to this video, make sure you check my other videos which I made about lockdown, quarantine and coronavirus. It will appear somewhere in the screen. So without wasting any more time, let's get started. Now, before I dive right into this, I must mention in the beginning of the video that we were asymptomatic patients, which means that we did not have any symptoms. Now, you might be asking, if you did not have any symptoms, then why did you go for a test? Well, we went for a test because my parents are doctors, and so we thought that we might transmit the coronavirus because we are unable to maintain the lockdown properly because my parents are doctors and they have to go out, and we did the test, and unfortunately it was positive. Now, if you don't believe me, here's my report of the positive test, and after 14 days I tested again, and fortunately I was tested negative, and also my sister. But unfortunately, my mom was not negative. I'll talk about this later in this video, but let me share how we felt when we got first tested positive. And it wasn't good. You know that it wasn't good. Like, even though we were lucky enough to not have any symptoms, but the fear of death crumbled upon us. Like, it just caught us. Like, I don't know how should I describe it, because it's such a horrible feeling, right? It made us realize the value of every second of life. Even though we didn't have any symptoms, we thought that our breathing problems might start at any time, and we had to always stay mentally ready for that. Now, the plus point is, we all, three of us, my mom, myself, and my sister got tested positive, and my dad lives somewhere else. So we did not have to maintain separate isolation. And we were thinking, like, if one of us was negative and the other two was positive, or the opposite, it would have been a chaos, because suppose my mom knows how to cook, but we don't. So if my mom got tested positive, then we wouldn't have any food. I'll come back to this later. There's a twist in the story, okay? So make sure you watch the full video to get something out of it. So yeah, mentally, it took time to bounce back mentally and start doing all the things which were recommended by the doctors around the doctors of my mom's colleague, my dad's colleague, and what the WHO and the CDC were telling. Because the news itself is a huge setback. I mean, I don't know, like, I have no words to explain, because it's such a terrible feeling that any time you might die, anytime you might have breathing problems, and breathing problems is one of the most terrible feelings. Like, you cannot breathe. Can you imagine how terrible it is? We take breathing for so granted, like, it made me feel the value of life. And thankfully I am healthy, I did not have any symptoms, and I thank to God, I thank to Allah for this. I mean, if you do not go through this, I don't think you will be able to understand what I am telling. And fortunately, my relatives were so kind, and they helped us so much, they prayed for us so much. Then thankfully I am sitting here, healthy and fine, helping others, sharing this information with you, sharing my experience with you, making this video. And I hope that I will be able to bring some positive change and awareness through this video and the works I am doing. talking about food and medicine. I cannot recommend you any medicine obviously because I'm not a doctor myself. Also, the medicine you take depends on the dose and your body, your health conditions, your weight, your age, and all those factors. So before you take any medicine, please contact your local doctor, because if you do not, then you might end up making a big mistake. And the medicines we had helped us to boost our immune system so that it can fight against the COVID-19 virus. So the doctors might recommend you similar kind of medicine, but please do not have any medicine without your doctor's recommendation. And talking about food, we had as much as healthy food as we can. And many people are thinking that through meat and chicken, the COVID-19 can spread fast, but it's a hoax. And because if you clean your meat before having it, if you cook it properly, then the virus was supposed to die in it, and you will not get COVID-19. Like for me, it helped me to fight the COVID-19 virus instead of getting it infected within me. So from my experience, you can have meat. It's totally safe if you cook it properly. And now remember, I told you there's a twist. Yeah, my mom was infected with COVID-19 for extra 7 days, and we had no one to cook for us. Fortunately, our relatives were so kind and so loving that they sent us enough food during that tough situation. And I thank them a lot. And before we went into lockdown, like in total quarantine, we bought all the dry foods we can so that we can survive. So if you are planning to go under a complete lockdown, and if you are thinking that you have COVID-19, and if you're planning to go under complete isolation, then do not forget to buy dry foods, because those are the kinds of foods which lasts longer in the fridge without getting, rotten or something. So yeah, and try to have eggs and as much healthy food and water as you can, because the main aim is to boost up your immune system so that it can fight against the COVID-19 virus. So talking about activities, I want to mention 3 things which is very, very important. And one is hot water gargling, taking hot water vapor, and exercise. Now, I do not know whether there is any scientific evidence about hot water gargling and water vapor, but it really helped me, and that's why I'm sharing it with you. And when you do that, please be careful, because you are handling hot water, and if it just spills over your body, then it might get burned out, and that will be another extra chaos, especially in this situation, because the doctors are most likely not willing to take care about non-COVID patients that much, because there's already a lot of added pressure of COVID-19 patients all around the world, and so getting sick or getting burned out in this situation will be really, really bad. And talking about exercises, try to do exercises, any kind of exercise which will make you sweat, and try to do that 15 or for 30 minutes before you go to bath, because you will be sweating, and you will obviously need a bath if you sweat. And wash your hands, obviously. Keep washing your hands. It's not like you're infected with COVID-19 and you don't need to wash hands. No, it's nothing like that. Keep washing your hands. After a few days of getting tested negative, my mom received a call from a family who urgently needs plasma. Now, what's going on in my country is there's a process going on called plasma therapy, where you extract the plasma from a patient who has developed the antibody of fighting COVID-19, and you put it inside the body of the patient who is suffering from COVID-19 so that the patient can recover faster. Now there's a shortage of plasma in my country because the recovered people are thinking like there might be something wrong, get infected or something like that. But my mom encouraged me and my sister to go for the therapy to give blood, and honestly I was a bit scared in the beginning because it was my first time of donating blood, and all those needle kind of things, like it's a bit scary, right? So I was a bit scared, but I did it anyway because I thought that if my plasma can help someone recover, then it will be a great achievement and a blessing for me. So it was a very good experience for me. And to all those people who are scared of giving their plasma blood, there's nothing scary here. The only pain you will get is the pinch of the needle when it goes in and when the doctor takes out. For me, it took around half an hour to complete the whole process of taking the blood and collecting the plasma. The hospital in which I gave my plasma, it had a very good system of collecting the blood and plasma, so fortunately we did not face any problem. People behaved really nicely with me there, and I felt really comfortable doing my job there. And after hearing the news that the COVID-19 patient had started recovering fast because of my plasma, man, it was such a great feeling because I literally saved someone's life. And here's the picture of me holding the plasma, and I was acting like this because there's my blood here. They took the blood from here. And to encourage others, the news reporters of our country took it up, and they are spreading it all over the country so that people get inspired, and the norm that donating plasma can be something bad breaks, because it's really urgent here. Like, this COVID-19 situation in my country is getting worse day by day. Like, people are not maintaining lockdown here because most of people are poor and they are not being able to maintain social distancing, and yeah, it's getting worse. So we need more plasma therapies. We need more people who are willing to donate plasma or blood. Now I'm telling you, like, before you go to donate, you need to have some requirements. You'll have to be an adult, you will have to be fit, and you will have to be a recovered COVID-19 patient. So yeah, it feels really good that I have saved someone's life, and now it is inspiring others to step up their game and help others. And I hope that this brings something positive. And not only that, I am sharing this message through this video, and I hope that the recovered COVID-19 patients who have antibody developed in their bodies will step up their game and help the world to get out of this pandemic. Now here's a word of advice from a person who has recovered from COVID-19. If you are thinking that you don't have any symptoms, so you don't have coronavirus, and now you can go out and do your normal work, then my friend, you can be very wrong, because from my own experience, I have learned that it's not necessary that a COVID-19 patient will have symptoms. Now that does not mean that every one of you will start testing for coronavirus, because that's going to add extra pressure on your healthcare system. And the more you go out, the more you're getting exposed to potential corona people. So stay under home. That's the first thing I want to say. And the second thing I want to say is, if you develop any symptoms like those cough and the pain on your throat, and you cannot, like, lack of taste and smell, then the first thing you should do is contact your local doctor, because it might be a seasonal thing as well. It might be a normal flu, or it might be a disease which is happening to you because of the change in season and other reasons. It might not be COVID-19. So the first thing you should do is contact your local doctor and take those basic normal medicines. And if you still see that it's not working, then you should go for a test. Now, it obviously depends on you whether you will go for a test or not, but please take into consideration the availability of your test in your country and your current health conditions, whether you should go for a test for the COVID-19 or not, because there is a chance that if you go out of your house and you go for the test, then you might get infected in that process. So try to stay inside your home as much as you can and follow the instructions strictly provided by your national body or national healthcare system, provided by the WHO and CDC. So yeah, that was it. I hope this video was useful. I hope my experience was useful. My parents will start working at non-COVID units from tomorrow, I guess. Unfortunately, it is a non-COVID unit, but that does not mean they're out of risk. So I'm requesting you, please follow the rules. Because if you do not follow the rules, then the chances of my parents dying will increase. And that is the main thing which sucks about being a child of two doctors. So please, thinking about my parents, thinking about the doctors, please maintain the social distancing, maintain the rules provided by the main bodies. And I hope this video was useful, and please do not forget to share this video because it's a very, very important video. I hope that this was successful in raising awareness, and if you like my content, then please do not forget to subscribe to my channel. I am leaving for now, and if you want, you can follow me on my Instagram right here. So I'm leaving for now. Goodbye.